Hey, I'm Dr. Jerry Williams with Urgent Care 24/7, and I'm here to talk to you about a medical health insurance topic that is frequently poorly understood in our urgent care centers nationally. And it's insurance deductibles. A lot of people don't understand what their deductible is. And there's a lot of confusion between insurance deductibles, is what this talk is about, and copays. So let me tell you what an insurance deductible is. Insurance deductible is the amount of money that you have to pay out of pocket before your insurance benefits start paying towards your medical care. So frequently we'll have patients come into urgent care 24/7 because we don't accept health insurance of any kind. We think that health insurance in primary care and in urgent care is completely unnecessary cost. So we're able to eliminate that cost by eliminating health insurance for primary care and urgent care, and can pass that savings on to our patients. Now, frequently patients will come in and they go, oh, but I have insurance and I have a $75 urgent care copay. But then we ask them, have you met your annual deductible yet? And they don't know what that is. So they don't understand that even though they have a copay for urgent care, they're very likely going to get a bill in 4 to 6 weeks after their insurance has been billed, where the insurance will then tell the provider, oh, this person hasn't met their annual deductible amount yet, which is the out-of-pocket expense, and then you're going to get a bill for the remainder of the visit. Now, deductibles are per patient. So if you're a family of 4, you may have to have a $4,000, $5,000, $7,500, up to $10,000 per person deductible. Now, what that means then, though there are some caps that they'll put on family deductibles depending on the policy, but typically family policies or husband and wife policies have they will have a per person deductible. So you have to pay, if your deductible is $5,000, you have to come out of pocket $5,000 per person for your care before your insurance is going to pay a penny. Now, the copay is kind of a participation or a utilization fee, where when you go to the doctor's office or you go to the urgent care center or you go to the emergency room, you have to pay a copay for utilization of that service. That is very different than a deductible, because the deductible is your total out-of-pocket expense that you have to pay per year before your insurance starts paying any benefit. Now, an interesting thing too is frequently we'll see patients who'll meet their deductible in December of the year. Keep in mind, when your policy renews, typically on January 1, your deductible renews as well. So you have to start all over again. In fact, the insurance companies use actuarial tables to figure this out, because they're writing insurance on huge numbers of patients, large populations. So it's really a statistics, it's a math problem to the insurance companies. And they do the math very well. In fact, they do the math so well that about 80% of all patients never meet their deductible. Think about that. 80% of us who have insurance pay for our insurance 12 months out of the year, but we never meet that out-of-pocket deductible, so the insurance company never has to pay a dime for coverage. Now, those other 20%, those patients do meet their deductible, therefore they'll get some benefit paid out from their insurance, their health insurance. So if you're starting to figure out that all this money that you're paying out for health insurance is kind of a scam, it's because it is. So big business has got it figured out, and they're going to do a hedge. That's what health insurance is. You're hedging your bets against, in case you have a catastrophic illness or life-threatening illness, where you would have a very high medical expense that would bankrupt you. Number one cause of bankruptcies in America is medical costs, healthcare costs. So you have health insurance to hedge your bet against this health crisis that could leave you insolvent or would eat up your net worth or a large part of it. Now, it's really important to understand, though, that when it comes to health insurance and it comes to deductibles, you really need to have health insurance in place, because if you do have a major medical event where you need health care to be paid for, you need that kind of major medical catastrophic health care insurance in place. The problem is we got away from major medical and we went to a health insurance that we expect to cover everything, like even the minor things like urgent care and primary care and flu shots and just the little things. And the equivalent of that, as I've said earlier, it's like expecting your auto insurance to replace your wiper blades and your brake light when it burns out. It's ridiculous. So no wonder health insurance is so expensive. But keep in mind, your annual deductible is an extremely important part of the equation for your health insurance. And also keep in mind that 80% of all people in the U.S. never meet their deductible. So I hope that's useful to you. I hope you can put that information, that knowledge to use when it comes time to renew your health plan next year. And you can save yourself some money and find the plan that's best for you and your family. I'm Dr. Jerry Williams with Urgent Care 24/7. Life is 24/7, and so are we.